At the end of this week, you will complete your 5th month of gestation on our Gregorian calendar. There's something new going on in your body. There is an amazing novelty in your baby's development that is totally connected to your emotions. What do you mean? Calm down, I'll explain. If you want to know everything that is happening to you with your baby in the 22nd week of pregnancy, stay with me and I will tell you. Hello, I'm Monica Romero. I am very happy to have you here with me at the end of your 5th month of pregnancy, and the belly is big, right? So let's talk about you. Let's talk about the size of that belly. Look what the difference is compared to the first week, right? First week of pregnancy. She's growing like this and getting round because her uterus, as it grows up, and you can already feel 2 to 3 centimeters above your navel, which is already flatter, right? As I told you last week, he won't go back to being 100% the same as he was before the pregnancy. But there's an interesting thing. If it's not your first pregnancy, your belly may be even bigger. We joke that the uterus has memory, so our body already knows what to do, so it ends up expanding. And this is also reflected in the size of the baby, which can be 10% larger compared to your previous pregnancy. I gave you a spoiler, didn't I? On the call, talking about the baby's emotions. It is that the limbic system, which is responsible for the emotions of the baby, is forming now, but this will also reflect on your lymphatic system, leaving your mood changes much more. Apparent, much more skin color, so it becomes easier to get emotional, it becomes easier to be happy, it becomes easier. Unfortunately, it becomes sad too. So if you notice major mood swings, you already know it's because your baby's mood is being worked on at that time as well. Ask everyone to be more patient with you. If you're sad, it's for pampering. Every pregnant woman deserves to be pampered. The famous Mrs. Heartburn, Mr. Reflux are still present. Unfortunately, progesterone, which serves to relax all the muscles in all the joints of our body, along with relaxin, it cannot act only where it needs to. It acts in the whole body, leaving our digestion very slow, leaving our digestive system slow. That's why we end up having constipation, because even the peristaltic movement slows down. What will we have to do to improve this? First, eat small portions, avoid liquid during meals, which can increase reflux, okay, because it will make your digestion even slower, so you have to drink before or after. Avoid foods that are too coated, avoid foods that are too acidic. For example, some people can't do anything with tomato sauce, pasta with tomato sauce, so my goodness, heartburn for sure. But for other people, they will have more tolerance for these foods, so you have to start repairing. Some antacids can be taken, but only with your doctor's prescription, okay? Self-medication, nananina, no, you can't. And despite the hunger, it is increasing because the little baby is growing faster. Our hunger also increases. We don't need to eat for 2 during pregnancy. 300 more calories per day at this stage is enough for you, who should have already gained between 4 and 6 kg. You may already notice that sometimes your belly gets harder, but it doesn't hurt and soon returns to normal. Then all of a sudden, the other day, he's there talking hard belly and all around are Braxton Hicks training contractions. It's just your uterus training. What should he do at the time of childbirth? Unlike the labor contraction, which decreases the uterus from top to bottom, Braxton Hicks are more materialized, they are not painful, and they do not have a rhythm. That is, they do not increase in frequency and time, as is the case with labor. I will leave a link for you here about the stages of labor for you to answer your questions. But calm down, that the white ones are rich, they are completely normal, and if you are not feeling it too, don't worry. That doesn't mean you can't have a normal birth. And last but not least, you've heard about the lack of memory of pregnant women, that pregnant women get forgotten then. That's not true. The truth is there's a lot going on with you. At the same time, you have a number of hormones that leave your mood fluctuating greatly. It's out of your control. And this, you have a lot of news, a lot of change happening to your body, a lot of new worries like trousers, maternity leave, vacation, bedroom. What am I going to do with my time? Will I be able to handle it? Are all these worries taking over your head? So if before you had 10 hours to think about 10 things, now you have 10 hours to think about 1,000 things then. So it's obvious that we start doing one thing, remember that baby thing, then stop doing it, start to go to another, then suddenly you have a contraction, you lose focus again, then you come back and you get that feeling of frustration because you're not doing right, or because you've forgotten important things, or because you're not being able to do it now, imagine later. Whoa girl, calm down, look how much is happening to you. It's perfectly natural for you to be confused or even forgetful. There are many things for us to do and for us to resolve. That's why I'm going to ask you, write down your priorities, everything that has a deadline, everything that you can't forget. Write down, your head is full of things. It's very, very new. On the other hand, there are some mothers who are super worried because they spend all day working and don't stop to talk to their baby. And send it to me, Monica, I'm a terrible mother because I came home late. I didn't even talk to my baby. I didn't caress him. Calm down, Mom. You spent all day carrying that baby. He spent the whole day being lulled by his rocking of his floor. He was lulled with his voice. He was lulled with his coming and going. He's been with you all this time. Just relax, okay? You're not a bad mother because of that. You can stay calm, relax, and whenever you can, take a minute, at least after the shower, to apply a moisturizer to avoid those stretch marks. And at that moment, you talk to your child. You tell him about your day. You talk to him, and he will become more and more closer, more in love, more interconnected with you. Okay? And let's talk about this most delicious, delicious papaya in this world. It is already measuring around 19 centimeters. Centimeters, if we consider the feathers, it reaches almost 27, weighing around 350 grams at the beginning of this week, and could reach 400 grams at the end of this week. And it looks like a doll, and even physically those dolls. You know that you are this height of 23 centimeters, 26 is my palm a little more. Like Barbie, who's about that size? Look how big he is already. When we take some element like that to compare, it gets easier, right? So you may think that your girl is a beautiful Barbie or your boy is a beautiful one. Who now? Your puppy already has his hair, but the hair is not yet pigmented, it is white. And what about the other news? It is that he already has eyelashes, eyebrows, eyelids, lips, and even the tooth buds that in the future will form his first baby teeth. And we will go crazy because they are very angry with the possible pain when they tear this gum. But some babies knew where they were even born with little teeth. It happens too. It is rarer to happen, but some are already born with their little teeth, and now you already know that they are already being formed already. The news that I like the most, that I was most eager to tell you, is that this week the baby's palate starts to get a little sharper. He begins to recognize even more the flavors that go there into the amniotic fluid. And out of curiosity, in the 4D ultrasound, they recorded babies making faces when mom generates a food very seasoned with garlic. I think they don't like garlic very much, but they adapt. That's why it's important for us to vary our diet a lot, to present a lot of food for them to eat inside the belly, because when they are in this extra uterine environment, they will be more familiar with the palates, and this can help you at the time of food introduction. What's going to happen there at 6 months old? The other news is that his legs have grown at an even greater speed and are now almost the size of his body. Do you remember what I said last week? That the eyelids were starting to open. They started to open and didn't open all the way. They are still in the same process, but their routines are beginning to be formed. However, babies will only see colors clearly around 10 weeks of life. There is this content on the baby's development month by month, which you can follow as soon as your entire pregnancy is over. There's everything for you here in the Parents' Almanac, by the way. Already leave a short one here for me. I already broke into the middle of the video so you don't forget. A very interesting thing is that it is because of this difficulty of the baby, as soon as he is born, to see clearly, nor see colors he can at the beginning, and as soon as he is born, the eyes of the newborn cannot see clearly the details, the contours. That's why our areolas are darkened to increase the contrast and find where he has to nurse. By the way, I'll leave you making a warm heart. Look at this video of a newborn breastfeeding. I'll teach you how to hold the baby. Don't worry, okay? As I say, baby sucking is instinctive, but baby grasping is not instinctive either for us or for our little ones. But I'll teach you everything here in the almanac. And in my nutrition tip this week, my focus is getting rid of cramps. He already woke up at dawn with his cough like this, shivering, hurting a lot. Usually cramps happen due to lack of potassium and also crisis. Potassium. You find the banana, but calcium, which is my focus this week, is also important for the formation of your baby's bones. It is also found in milk, dairy products, and some other foods such as walnuts, peanuts, raisins, broccoli, skinless sardines, soy flour, chickpeas, almonds, chard, prunes, cooked black beans, cooked pumpkin, oysters, and of course in the famous milks and derivatives. And the most famous derivatives are yogurts and cheeses. And in my tip of the week, there are two. The first are some substances that you can't put on your skin, which is very found in cosmetics, for example, lead, urea above 3%, camphor, and in these anti-wrinkle creams, we find a lot that also can't during pregnancy, salicylic acid and retinoic acid. The two of us cannot during pregnancy. And then you tell me, Monica, I use this, I didn't know, so you'll take it easy, okay? First, breathe. Calm down, it is forbidden to do any test on pregnant women, so we don't know what a safe dose would be. That's why we say you can't, but I'm not going to tell you to get desperate. Stay calm. You are doing a proper prenatal. You are following the doctor's instructions. You are doing the exams. You have done the morphological test. Now, this is the best week to do the second trimester morphological test. You did this morphological. You can see the baby's entire body. You can do a 4D ultrasound with A. To see the baby's entire face, mouth, nose, eyes, ears, hands, you can see everything. And of course, in this morphological, the doctor will also see, as I told you already in the other videos, but I will repeat, the heart and its chambers, the functioning and development of the brain, the kidneys, the liver, all the organs of your baby. You will also check your baby's size and weight. And we usually make this measurement through the size of the baby's femur and head. It will also see some important things about you, such as how much amniotic fluid is, and whether your placenta is in the right place, or if you are at risk for placenta, risk or non-diagnosis of placenta previa, which are these cases, as I left here for you. But there is a link that I explain better about placenta previa and care. I made a quick summary here about the morphological ultrasound of the second trimester because I have already talked about it in the previous videos. And coming back, if you have taken any past some of these medicines, these cosmetics, suspend use immediately, notify your doctor, but don't worry, okay? You didn't abuse, no, that's not it, so you're calm. And about medications that we take, you don't do it on self-medication either, right? It also cannot, including acid, still salicylic, cannot have self-medication of it. And there is a medication based on frutamide, which is mainly for hair loss, which also cannot be ingested during pregnancy. So if you make any use of this, these medications, especially cosmetics, be careful and tell your doctor. And my tip number 2, I think she's really hot. So, did you choose your baby's name? If you chose, tell me, please, here in the comments. I love knowing names. There are creative names, traditional names, names to honor, names because of meaning, names that the person has already decided since the age of 5, and names that we have never thought of and don't know what to do and don't even know where to start. If you are in the Don't Know Where to Start club, I will give you a tip. You and your partner will take a piece of paper and you will write several names that you like. Go get inspired, write several of these names. Then each one will do a flattening there. It will reduce it to 10 names. It didn't manage 10, 15. It will go 20 at most. Each one, you're gonna put all these names together. Sit at a table over time and then everyone will eliminate one. Instead of choosing, you're going to eliminate why. Sometimes you love a name, but he can't stand it because it reminds a person that Our Lady that he didn't like, or he loves a name and for you it doesn't refer to a good thing, you know. The phonetics are not good. You can't imagine saying that name 483 times a day because that's more or less what you're going to say. 485 on the day, plus 81 on the day less will speak this name a lot. this name and surname matches, they do the tests and eliminate them. That's how the name Lucas, my eldest son, came about. Flavio and I, we had no idea. I liked several other names, he liked several others, and we didn't get along. He wanted Enrique, I wanted Andre, and then in this whole salad of writing names and then choosing, Lucas was left, and I don't regret it at all. I love my son's name, so I'm going to suggest that you do the same thing too. And there are also a lot of people who let them choose the name when they give their baby a face. They see that the name suits them, and there is no problem at all. But it's fun for us to start doing these things that bring us a little pleasure during pregnancy, besides spending money on trousseau and spending money on room. And take the test and draw the blood, my God. I really hope that you enjoyed this video, that you are well, that I made you smile while you hear a little about your 22nd week of pregnancy, that you enjoyed seeing your son's face, imagining how he is. Let me know in the comments what you think. Don't forget to let me enjoy it for myself, and I'll see you in the next video.